Okay, welcome back to another video about OCD. OCD, so-called Obsessive Compulsive Disorder, is something that afflicts 2 to 3% of the population, quite a lot of people. But it can also afflict a lot more people on a lower level and make their lives relatively hard. And of course, these 2 to 3% of the population, they also have family members who can be really affected by this. And I'll talk a little bit more about that later. Right now, I want to do the gold standard of OCD treatment is so-called Y-BOX, Yale Brown Obsessive Compulsive Scale. And they have made a very good list over the symptoms that can be classified as obsessive compulsive disorder. Actually, the name obsessive compulsive disorder should probably be changed. It's much easier to think of it as doubt. And when you doubt if you have turned off the oven, you doubt if your hands are clean enough, and over responsibility. You feel that everything is your responsibility. You doubt whether you have done something wrong, and then you think it's your responsibility to do something about it. It's your responsibility to check almost all the electrical contacts in your house, all of them actually, because you think that only one missing and it will be my fault if the whole apartment complex burns down. If you have bad thoughts, thoughts about harming, then you think, I might do it. I've thought about it, but I might really do it. Okay, so it's the doubt. And also responsibility, because you feel that I'm responsible to do something about this. I've had a really bad thought about stabbing my kids with a knife, which is a typical OCD thought. And I have the responsibility to do something about it. So we throw out all the knives, and I'm never going to be with my kids again because I might strangle them too. Okay, it might seem like I'm making fun of this. Is absolutely not funny at all, but sometimes humor helps in the treatment. And I know because I've had these knife grotesque thoughts myself. And what made me get over it was that I read a book where it said 51% of the population admit to these kind of thoughts if they can respond anonymously. And then I said, okay, that must mean that a lot of people have these thoughts, but a lot of people, they just let them pass and say, that was a weird thought, just like a weird dream. I don't have to concern myself about that. It's just a thought that popped into my head. Doesn't mean that I'm a bad person. But usually people who suffer from OCD or doubt and responsibility syndrome, as I would call it, they're very responsible. They are very good people in most cases. They're very caring. They don't want to be responsible for anybody's problem at all. So, doubt and responsibility disorder. Okay, I've made a video where I started on these typical things that people can have, but I will start again because I will show what can you do to get rid of it. And this is in the tradition of exposure training. And I put weight on the word training because it is through practical, real-life training that you can actually get better. You can't talk yourself to this. There is no talking cure for OCD. That's why people were very discouraged only 20 years ago. Typical therapists who did talking therapy, there's nothing we can do with these people. They just don't get it. They just don't get that they don't have to check all their contacts 50 times before they go to bed. They don't get it. But it is when they train again and again on taking the risk of going to bed even if you're not 100% sure that everything is out. So it is training. You have to do it yourself. No talking is going to cure this. No therapist is going to cure it for you. You can only do it yourself. So I will take 5 of the first ones now and try to suggest what you can do about it. First one is aggressive, obsessive thoughts. I would say just aggressive thoughts. And the first one is, I'm afraid I'm going to hurt myself. Then people can be afraid of eating with knives and forks, afraid of using sharp objects, afraid to go near windows, and also would be very afraid of going on high places where you could actually jump, or being in the subway where you could jump in front of the train, or driving a car where you could just turn a little bit on the steering wheel and you would run into that big lorry and you would be dead. You might do it. You might just do it. Okay. If you are in any of these categories, that you are worried that suddenly on an impulse you might hurt yourself, it's typical OCD. And what would be the antidote? Okay, let's take the one with knives. Okay, you're afraid you're going to hurt yourself with a knife, that you're suddenly just going to cut off your finger or something like that. Very classical OCD. And I must say, I have had thoughts in that category too, but these, for some reason, I've been able to say, that's too weird. That's probably something everybody has. And now we know that everybody has it. So, one very interesting therapist, a big therapist physically, Marty Franklin, had a seminar here in Norway, and he said, well, before we thought that it wasn't that common, but then we've asked more and more people, and now 80% say that they have these weird thoughts. Like he himself had a thought of maybe his the head of his mother-in-law could be chopped off by a tractor that just won't buy them. Okay, so 80% have these thoughts, and he said the rest are lying. Probably. It's probably a totally normal human phenomenon that all people can have very grotesque thoughts that pop into their mind. Okay, so what can you do? If you're afraid of knives, okay, the typical thing would be to have a lot of knives around in the kitchen and just stay in the uncertainty, the anxiety that comes when you do that. If you're afraid of cutting yourself with glass, okay, break a bottle and have it lying around the kitchen for days. Then you can see that, okay, after a while you'd be rid of it. But the point is that you stay in this uncertainty about whether you're going to hurt yourself with these things. You stay in it. You let it rip, so to speak. The point is to get as much anxiety as you can and just realize that anxiety is absolutely not dangerous. Actually, I had an anxiety patient once who was very surprised. She was afraid of everything with her body, that her heart was going to stop. And so she went to a doctor and pestered him until she got one of these tests where she rode a bicycle and they measured the gases she was breathing out and heart rate and everything. And she passed it with flying colors, and the doctor was very impressed. He said, but why? I don't understand. You say that you are so handicapped by your anxiety, but you are in excellent physical health. Now I know, said the doctor. Now I know. Why didn't I think about that? You say you have a few anxiety attacks per day. Well, that would explain it. Your heart and lungs get the training every day. That's what it is. So anxiety is actually not dangerous. The more, the better. And you get the exercise, the free exercise. Don't worry about it. Then you don't have to exercise today if you do the anxiety trip. So put these glasses around. If you're afraid of forks and knives, leave them around. Certainly do not start eating with plastic forks. Eat with the sharpest forks and sharpest knives. You can have these beef knives, very sharp. Okay, what else? For instance, if you're afraid that you're going to jump in front of the subway, I would say you, on your own initiative, has to stand very close to the subway and go to the subway as often as you can and stand closer and closer to the subway track. Okay, just to see that, hey, you're not going to do it. A very good OCD therapist who had thousands of patients said it doesn't happen. But now this is reassurance. Actually, I should try to make you more insecure so you could stay in the insecurity, but he says you can say this to the patients once. I will say this only once. I've never had any patient who have acted on these things. Out of probably 25,000 patients, nobody has acted on this. And then he says, to not take away the training effect of the insecurity and anxiety, but you might be the first. Okay, so the point is to not reassure people too much. They have to experience that this is a real anxiety. They stood in it and it passed. Okay, if you're afraid of driving into trailers, into big trucks, into other cars, you should drive a lot. You should drive a lot and be happy if the insecurity comes. Then you say, this is training. This is exactly what I need to train. Ah, great, now it's coming. So you reframe the whole thing. Okay, but I'll stop this now and then continue on the next because this becomes a bit long.